And I'm Dr. Anil Goody, and this is Dr. Amit Shah.
Hello.
And again, we are looking at a controversial subject to discuss, looking at it from the evidence-based medicine and trying to get an idea of how things are going. Amit, I want to ask you about platelet-rich plasma, PRP as commonly known, which has a huge following and use across the world. Where do we stand and what is this?
So basically, Anil, let me give you a bit of an idea about what platelet-rich plasma is. Platelet-rich plasma treatment has been used in the last decade quite increasingly and alarmingly for various areas such as musculoskeletal injuries, hair regrowths, and obviously reproductive medicine is now becoming more and more involved in the platelet-rich plasma therapies. Now, I completely understand the frustration that we have as clinicians in a group of patients who have got very poor endometrial development or have got poor endometrial follicular growth or less number of follicles. And that frustration often leads to positively sometimes and sometimes negatively new therapies coming into clinical practice. I was quite intrigued as well to know a bit more about platelet-rich plasma because that is not something what you and I practice in the United Kingdom and most of the developed world. So Journal of Assisted Reproduction and Genetics in 2018 has published a very fantastic review of where we stand with these treatments. The scientific data is just not there. The numbers are just not there. The initial Chinese study published had shown 5 patients enrolled in that research studies. There's been not a single research study which has showed more than 10, 12 patients being enrolled. And clearly coming to a conclusion based on such small numbers, which often tend to show huge biases, and biases get quite multiplied, it literally seems that everybody who has this treatment is getting pregnant. Now, if you look at it with a fine-tooth comb and analyze it critically, as one should do the evidence in front of you, you soon tend to realize that there just isn't a mechanism of action or a plausible mechanism of action yet described. No one knows what it does. No one knows how it works. And the scientific data is just not there. And yet again, reproductive medicine especially, because of the frustrations that I mentioned before, have jumped in and put this into clinical practice without having robust clinical trials. And I certainly feel very strongly about it. And I really feel that this may actually put our patients at disadvantage in future. We have not evaluated this therapy and clinicians have just jumped onto this new bandwagon. So that's where I think we are with these therapies. And there are possible anti-inflammatory effects, antibacterial effects of plasma-rich, platelet-rich plasma, etc. But there are no robust studies. And that's the problem.
Looking at many things, when we look at how reproductive medicine, I agree, I understand the frustration. And when almost we come into the final frontier of science where our treatments still don't work, and I can understand the frustrations that come up, and we look into the horizon at areas like at PRP, at GCSF, at doing more bone marrow transplants and infusions. And here, one of the things that continues to worry me is how is it that you take somebody's own blood and take the platelet-rich plasma and then put it, and how is it that the same treatment can be used for hair, for bone, for teeth,
yes,
and then for uterus.
Yes.
And then I've seen advertisements where people have used it for far more sinister and completely bizarre reasons. And where are we getting to this treatment in the next couple of years? Do you think we'll have the depth which we have seen of all these, some of the crazy treatments?
Well, just like, if you had a chance to look at the publication from the Oxford University about various adjuvants that we use in fertility treatments and assisted conception, and they had very beautifully analyzed 28 different adjuvants and shown that even something as scientific as pre-implantation genetic screening still doesn't weigh up. Endometrial scratch has come and gone. endometrial scratch is no longer recommended. And in situations like this, in a clinical environment that we live in a medico-legally difficult environment that we practice in, I think applying something like a PRP for endometrial development, injecting it into endometrium, injecting it into follicles and ovaries, amounts to giving patients false hope. And there are clinics making a lot of financial gain. And I can't help but think that this, to me, is a hugely unethical practice. And I very strongly stand against it. And my views are that until someone shows to me that there is a robust science behind it, there is a logic behind why we use it, and actually publish truthful, randomized controlled trials and data, I'm not prepared to accept this treatment. And I'm seriously and genuinely worried that it will harm patients. That's where I stand. Thank you very much.
So that's again another tip for the week. Thank you.
And I really hope that clinicians who are using these therapies remain very conscientious and careful and be honest to their patients. And my advice would be strongly not to use these treatments in desperate group of our patients. Thank you very much.